I'm Amy. I'm going to be your nurse practitioner student today. I am going to do some hand hygiene, and we have your vital signs. Everything looks normal, but today I'm going to assess your cardiovascular, your respiratory, your peripheral vascular, and your abdomen. Are you having any issues in those areas?
No.
Okay, so we're going to start with your respiratory system. I'm just going to observe you for a second and look at your respiratory rate and rhythm, and just your breathing pattern. So your respiratory rate looks completely normal. I don't see you using any accessory muscles. I don't hear any wheezing. You don't look like you're in any kind of respiratory distress to me. And I'm going to look at your side and your back. Look at your diaphragm, which looks normal. It's symmetrical. I don't see any deviation in your trachea, so that's good. So now I am just going to palpitate areas to see if there's any tenderness. Are you having any tenderness anywhere?
No.
Okay. So just tell me if any of this hurts. Does that hurt at all?
No.
Okay. All right. And I am going to test your chest expansion. If you'll lean back for me, just taking a deep breath. Good. And you're symmetrical. I'm going to have you turn, and I will test your back, your thorax. Good. That looks normal. All right. So now I'm going to perform tactile firmitis. I'm going to have you say 99.
99, 99, 99, 99.
Good. I'm going to try your back. Posterior.
99, 99, 99, 99.
Good. So your vibration is equal. So that means there's no underlying diseases there. And now I am going to do some percussion. So we're going to start here. Let me get into my stethoscope. So I'm just looking for dullness and resonance. Good. All right. Into your back. And that's normal. And then I'm going to do your diaphragm. Good. Now I don't hear any areas that shouldn't be dull or anything like that. And let's see, next up we are going to take a listen to you. I'm just listening for your breath sounds. If you'll open your mouth and take a deep breath in and out. Good. Good job. Keep deep breath in. Good. I'm just going to listen to you posteriorly. Deep breath in, and again. Good, and one last time over here, and one more over here. Perfect, so I don't hear any wheezing, crackles. You're clear in all quadrants, and since you don't have a cough, we won't do post-tussive oscillation. And then we're going to do voice transmission. I'm just looking for bronchophony by you saying 99. So if you'll say 99 for me, once you hear my stethoscope.
99, 99, 99, 99, 99, 99, 99,
Good. And now I'm going to just have you say E, and I'm just looking to see if it changes to an A for agaphony.
E, 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 E.
Good. So you're nothing abnormal in that area. Now I'm going to have you lay on your back, and we're going to do your cardiovascular system. I'm going to have you look to the left. I am just going to look at your JVP and your carotid pulse. So they both look normal. And then I'm going to look at your PMI, which is normal. So I am going to feel your carotid pulse, looking for thrills, which I do not feel. And I'm going to measure your JVP. Good, so you're right at 2.5 centimeters, so that's normal. And then I'm going to palpate your PMI. And then I'm going to assess your systolic right ventricle, your pulmonic artery impulse, and your aortic arch, which those feel normal. So now I'm going to listen to them. To your aortic and then your pulmonic. And your apex. I'm going to have you turn on your side, and I'm just going to use the bell of my stethoscope to check for mitral stenosis. Good, I don't hear any mitral stenosis there. I'm going to have you sit up and lean forward. And I'm going to elicit for aortic murmurs. And I don't hear any murmurs there. All right, so now we're going to go on to your peripheral vascular system. So I'm just going to inspect your arms and legs and everything right now. So your skin looks good. I don't see any lesions or scars or veins popping out at all. Any varicose veins, anything on your arms and legs. I'm going to check your capillary refill, your fingers and your toes. They're good. I don't see any edema in your legs, and you're warm to touch, so I don't see any circulation issues. I'm going to feel your dorsal pulses and your posterior tibial, and they are 2+ bound. I'm going to feel your popliteal, and then I am going to feel your radial pulses and your brachial, and those are both normal. I'm going to feel your epiclocular nodes. Have you bend your arm to 90 degrees? I do not feel any masses or inflammation there. I'm going to have you lean back, and I'm going to feel your femoral artery. Good. And then I'm going to feel your lymph nodes. I don't feel any hernias, so that's all normal. So now I'm going to look at your tummy. We'll do your abdomen. So your abdomen is flat. I don't see any inflammation in your belly button or any hernias. I don't see any striae, or any skin conditions. And let's see, I don't see any aortic impulse. And now I'm going to listen to your bowel sounds. And your bowel sounds are normoactive. I'm now going to listen for your aortic artery, and then your renal arteries, your iliac arteries, and I'm listening for bruits, and I do not hear any. And last I'll listen to your femoral artery. So that's all normal. And now I'm going to percuss in, for your liver scan, just to make sure you have a normal sized liver. Still see. All right. So it looks like your liver is about 7 centimeters, which is normal. I'm going to test for your spleen. And I don't feel any splenomegaly. I'm going to feel your aortic pulse. Okay, looks like it's about 3 centimeters, 2.5 or so. And then I am going to I'm going to have you bend your knees, and I'm going to just fill up your tummy. Go ahead and bend your knees. Now let me know if you have any tenderness. I'm going to lightly palpate. Are you having any tenderness?
No.
Okay. And then, let me move this so you can see better. Okay. So now I'm going to do a deep palpation. Let me know if you have any tenderness.
No.
Okay. Any tenderness?
No.
Okay. So I am just going to feel for your liver. Take a deep breath in. Good, I can feel it there. Just barely. And check for your spleen. And I'm going to check for your kidneys. And that feels normal. So now I am going to, also looking at your stomach, I don't see any peristalsis, so there isn't any obstruction, so that's good. And then we did the aortic width. So now I'm going to check for appendicitis and cholecystitis. So on appendicitis, we're going to do 3 different measurements. The first one, let me know if you feel any pain when I push down on your left side, if you feel it in your right side. Are you having any pain there?
No.
Okay, good. The next one, the psoas, I'm going to lift up your leg, just relax. I'll lift it. Let me know if you have any pain. Any pain there?
No.
Good. The last one, I'm going to have you turn over. And I am going to move your leg in a flexing position. Let me know if that hurts at all.
Okay.
Good. All right. I'm going to have you move back to your back. And we're going to check your gallbladder for cholecystitis. So I'm going to have you breathe in, and I'm going to push in. Let me know if you have pain, okay?
Mm-hmm.
Any pain there?
No pain.
Good. So now I'm going to have you sit up, move your shirt down. And I am going to check your CVA for tenderness in your kidneys. So Let me know if this hurts at all. Any tenderness there?
No.
Good. All right. Well, I think that wraps up our exam. Do you have any questions or concerns for me?
No.
Okay, thank you.